Welcome back again, Council. I'm going to call the meeting to order. Any conflict amongst council members here this afternoon? Seeing none, I need the adoption of the published agenda for this meeting. Need a mover, please. Deputy Mayor Malash and Councillor Bowman, all in favor? That one's carried, and I need a mover for the special meeting. Could I have a mover, please? Councillor Guerin and Councillor Bondi, all in favor? That one's carried. So at this point here, we'll go right into public presentations. And I'd like to introduce Leonardo Gill, Project Manager, Social Policy and Planning, City of Windsor, John Matheson, and Olivia. Don't hit me through the screen. I think I might have it. Heavy, is it? Am I close?
LaHaye.
What is it? Go ahead.
LaHaye.
Oh, LaHaye? Okay, sorry about that. So whenever you're ready, you can go ahead with your presentation.
Thank you so much, Your Worship. And with the clerk's permission, I'll just share my screen. Oh, I have been disabled from sharing my screen, so if I can just be permitted to do that, I'll be able to present to you briefly on the package.
Go ahead. Go ahead. You can try now. You should be there.
There we go. I think you can see that now. Thank you very much for making the time. I will try and be very quick because I know you have a demanding agenda and I know there's lots to talk about for you today. So rather than reading at you the entire material that's in your package that you could very well skim on your own, there's really three main points that I'd like to cover today. The first is, as you know, the community safety and well-being plans, they came upon us as a requirement of the Ministry of the Solicitor General. And, you know, as such, I think everybody looked at them and sort of said, you know, what's this? Something more that we have to do. But what's been quite remarkable about them is that they bring together a lot of very important different groups of people who serve the community through various different lenses. And many of these have been brought together in the leadership table and then the enhanced sector network that have been providing much of the leadership to this project. And if you can see the little diagram that sort of looks a little bit like a dartboard, the thing that's really important about that diagram is that too often when we're serving people, we serve them not putting them at the center of it and by getting to their needs only when there's actually been an incident. And the whole logic behind the community safety and well-being plan is that we should be moving up the chain so that we're not waiting till the end of an incident to respond to, but that we're trying to either intervene before the incident happens, or better still, prevent the crystallization of the risks, or better still, do the kind of social development that keeps these problems from happening. And so the development of the plan has brought together all sorts of different community groups, you know, ranging from the police and those in housing and those in mental health and those in addictions and those in education, to try and take this holistic approach to the identification of risks and the accumulation of data. And I actually think that the methodology is hugely hopeful, because almost any of the people who need the help typically need the help of each of those services, not just any one of them, and they need to be able to access them in a way that makes sense to them. And so if you only understood one thing about what community safety and well-being planning is about, it's about trying to change the way we think about delivering services to put people at the center instead of making people figure out how to navigate organizations. And so I think that's probably a very hopeful thing. So you can follow through the document and you'll see there's been all sorts of consultation that's gone on, and the project has been extended a little bit because of the nature of COVID. But it's really focused on these particular areas of crime and victimization and education and financial security and mental health and substance use and physical health and housing in neighborhoods and vulnerable populations. And then, of course, everything we've learned about COVID-19. And so in communicating, it's been with members of the public through surveys, it's been I think I recognize several of you from the community meeting that we had back, I believe it was in March. Kind of nice actually that the sun is still up now that we're talking, and as opposed to the pitch blackness that we had then. But you can see in the document, and I'd invite you to take a look at it, you can see the levels of participation that went on. And I think, you know, we had a nice level of participation. We didn't blow the doors out with, you know, 1,000 people turning up for an individual meeting or that, but we heard lots of diverse opinions. The chart on slide 7 is kind of an interesting one for you, because as you run from left to right, you see the priorities of the various communities. Those are the things that are shaded. These are the ones that were the most frequently answered. What's your biggest priority? And the list of priorities runs down the page. And you can see on this one, what's kind of interesting is you can see the similarities across Windsor, Essex. You can see how many talked about housing in neighborhoods as being a real priority. Look how mental health and substance abuse was, you know, pretty much a dominant concern everywhere except in Tecumseh. And you can see how in Essex, folks talked a lot about employment and skills development and special education as being something else that's very much on their mind. But those were some of the priorities that we heard about. As we keep moving through the document, you can see that and I certainly won't read these at you, but there's lots of different quotes that are sort of meaningful about what different people said in various sessions. And this is just the summary document. The final report will be much more robust than this. We're just here to give you an update today. But you can see one of the first comments there from an Essex resident about needing to find ways to attract people to the community and allow our young people to stay who are currently being driven out because of the lack of affordable housing. And so, you know, that was the kind of comment that we were hearing, but you know, I wouldn't want you to think that that's all we heard by any stretch. And you can see as you can, you know, leaf through at your residence, at your leisure. Lots of other comments about the accessibility of transportation, both within and between municipalities, and helping people being able to access. So I think there's quite a diverse set of voices that we've heard, but what's significant about them is how they tend to point in a coherent direction as opposed to into all sorts of different directions, and how there's a lot of common basis for collaboration at the county and Windsor level. The next section provides a more detailed consultation on some of the things that we heard specifically in Essex. And so this dives a little bit deeper. And, you know, the main message that I'd tell you about the data that's been collected through this process is, however good it is now, it's going to be way better in another couple of years. Because one of the great things about the whole process that lurks behind these community safety and well-being plans is that you do them once for the first time. And so all sorts of people who aren't in the habit of working together start working together. But the idea is to create these tables and start the sharing of data, which will mean we'll never have the data gaps that we had before again, because the whole point is to make the collection and maintenance of quality data on these subjects a kind of a permanent thing. And I think that's also a really important piece. You know, like, you know, I'll be very blunt. It probably wasn't the greatest idea to start one of these things in year 4 of a Canadian census cycle, because it's way better. Like we'd be sitting on much better data if it had been done in year 1 after a census. And I think that's one of the ways in which it's going to improve. But quite a bit better than that is going to be the way the tables are going to become permanent and continue the collaboration of all these different people in the different agencies over time. And that offers an ability to really improve the way in which we serve people and kind of take it from the most expensive and least humane and least effective way of serving people, which is when there's been an incident, and put the efforts of these various groups through the sharing of data and the sharing of information and put it into preventing things from happening in the first place. And I think that's what's really hopeful about them. So I'll just jump to the other slide, which I think you may find really interesting. This is the one that sort of summarizes the regional priorities and opportunities once you collect all the various data and run it through the various filters and that. This starts to be what it all looks like collectively. I'm going to start on the right-hand side. And this is sort of like the permanent procedural matters that give us a reason to believe that things could improve, because it's all about improving the governance of how these various agencies share information and collaborate together. And so to reduce the barriers amongst the providers. How many times have you heard the story about the person who needed housing, but it wasn't supportive housing and they couldn't get home care and they were having problems with mental health. And so they had to go to Windsor, but they couldn't go to Windsor because there was no transit for them. And as their situation deteriorated, it became a family violence situation or something that wound up involving the police. And so the whole thing escalates to a point that is extraordinarily unsatisfactory from the point of view of how we've helped the people solve their problems, but also from a point of how many people we had to have, doing repetitive and clean up the mess after it's already happened kind of tasks. And so this first column on the right-hand side is really important because it talks about reducing the barriers and creating the framework for collaboration. Because right now, there's always a privacy lawyer who can tell you why the police can't share information with a mental health provider, or why a housing person can't share information with the police. And so one of the things that's really hopeful about this whole process is to put in place data sharing agreements that can let you achieve a sort of this approach to incident mitigation. So that's the real lasting procedural thing: better governance and better data. Now, the other three are priority categories, the things that we want to have: sort of engaged in safe communities, improved mental health and substance use supports, and the kind of financial security that keep people out of poverty in the first place. And then some of the specific opportunities are set out below that could be understood as being priorities to try and increase access to affordable housing, or better community engagement. And we heard again and again the importance of infrastructure that promotes active transportation and community safety, with like better walking and better lighting. And that came up again and again. Improving relationships between communities and the police, increasing awareness and destigmatizing supports on mental health, because I think what kind of knocked everyone's socks off was the degree to which there was a real perception of the problems around the mental health and substance abuse side of things, particularly with the heightened challenges that people experienced during COVID. And you can see some of the other ones in that column. And then, obviously the biggest single challenge, and one that obviously involves the province more than anybody else, but access to employment and aligning and leveraging supports and trying to fill some of the service gaps that make, too often it feels like the investments that we make in solving part of a person's problems don't go quite far enough to solve enough of them that they're actually better. And so the idea through all of this is that through a more holistic approach of bringing together the work of all these great agencies that coexist but don't necessarily have a vehicle for collaboration, it's to try and create that vehicle. And I think what's really optimistic about community safety and well-being plans is by the end of the year, there'll be one covering pretty much every part of the province. And it's my belief that what's going to happen is whether it's the Western Ontario wardens, they will do a session where they share the best practices that come out of, say, all the counties in the West, and people will start stealing each other's best ideas. And where these bullet points are going to go from general direction statements into best programs that are really helping people in the community is when we have a common template, which, the best thing about public administration is there's no penalty for stealing ideas. Like, it's what we're supposed to do. They call that sharing best practices. And I think what's probably going to happen is once everybody's on a common platform, it's going to really facilitate the sharing of best practices. So just the last point I can make, and then I'm happy to take any of your questions, is the next steps for finishing the plan are going to be to continue further sharpening the priorities and strategies, and putting together a bit of a performance and outcome measurement plan, because nobody's more aware than us that some of these things are still a little bit vague. So it's sort of sharpening them up a little bit. And then we look to be coming back in the fall to actually present a finalized plan to each of the member councils. And this sort of comes at the moment just with an invitation to each of you. We would obviously be truly delighted to have any input that you might have at this time as we're continuing this work, because the work of sharpening up the plan is still ongoing. And while Leo Gill, who was introduced to you at the start, couldn't be here, he would love nothing more than to hear from any member of council, around these questions. And his contact information is at the back. And knowing Leo, you could give him a call, you could send him an email. He would like nothing more than to give you a chance to talk about what might be on your mind now that you've got a little bit of a sense of the general direction that things are going in. Because the whole point of the process was that it be inclusive. And today was really just to give you an update on where it is in the process and to extend this invitation to you that the time for further input isn't over. And I think I can probably leave it there, Mr. Mayor, with this sort of general sense of, I think that this plan, what it's going to do, the real lasting legacy of it is going to be over here on the good governance and data, because it may seem kind of funny that it's taken us from Confederation to 2021 to sort of do a really determined attack on the breaking down of silos between agencies. And obviously there's all kinds of work that goes on individually day to day by great people who are service providers that, bridge between those things. But this is really sort of the province recognizing that we can do better and kind of creating a common forum for everybody to think about how to do better, think about how to share information better, think about how to really manage this whole problem of going from incident response to the kind of social development that keep bad things from happening in the first place. And so it's not so much a Surlock's bound report that you'd wind up when it's done sitting on a shelf. It's more a way of delivering service to people who need it to optimize the value for money equation. So I hope ultimately that it will turn out to be a very hopeful and very useful and ongoing thing for all of the municipalities and ultimately deliver much better service to folks. So thank you for letting me tell you about it, and happy to take any of your questions.
Thank you very much for the presentation. Very interesting. At this point here, once we get the screen open, I'll open it up to
Sorry,
council.
Stop sharing there. Sorry, Mr.
Yeah.
There we go.
Okay, I'll open it up to council. Any questions from council? Councillor Bondi, go ahead.
Thank you, Mr. Mayor. Not so much, but more so comments on the plan. I think it's great and it's a really good start. It's good to have a benchmark of where we are, right? And I see lots of things are standing out to me as we go through this process. So, and even some of the scores where people are saying, they're 55% satisfied with educational opportunities and programs for children, right? Like that's not very well satisfied. Like we have a lot of room for improvement, and I have lots of ideas on how we can improve that. And I think our municipality is one of the more unique municipalities in the region because we have 4 urban centers, in particular Harrow and Essex Center, that have unique needs. So one of the things that I think we could do is look at in the short term, in January 2020, council decided to get rid of the contract manager position, and we have a cost savings with the OPP contract there. So there's been some preliminary discussions, but nothing really concrete. And it's been 7 months since January. So something that I think is measurable and doable in the town of Essex is having that hardcore conversation about speeding and traffic enforcement. And when you read through this report, it says, safe communities, traffic enforcement, speeding, that is one of the top complaints I still receive. People with young children, people want walkable communities. And right now they don't exactly feel that's walkable. So I would hope that this council would sooner rather than later not wait another 7 months to have that conversation, because that's really something that we need to let our residents know that we're listening to. Another thing in terms of, we're really good at building houses and, we have a hotel coming and all of those great things. So we need to work on building community. How can we do that? Well, a community hub in Harrow where the youth, where the seniors, where we have arts, where we have drama, where we have sports. That is something that I think would bring a lot to the community and increase the wellness in the community connection. The two comments from the Essex residents, you can certainly tell that one is from the southern end of our municipality, where it says school closures have had a major impact on youth in the whole community. Youth need to travel farther to get to school and all the supports and benefits the school provides. They have an extra hard time accessing co-op programs, extracurriculars, volunteering, and social opportunities. This council needs to grab hold of some of these items, and we have a responsibility to this plan and to work on this. You know, the 55% satisfied with educational opportunities and programs is how we can come in and really make our communities one that people want to live in. You know, in Harrow, there's lack of daycare spaces. You know, we have a wait list on our daycare, and there's lack of things for the youth to do. So I'm really excited to see the plan and start rolling out. And I have lots of ideas and lots of things that I think could be measurable. So thank you for putting it together. Thanks.
Anybody else from council? Nobody else from council? Councillor Bowman, go ahead.
Just a comment. Several years ago, we saw the benefits of working together when the police and the mental health started to develop a system where they could work together and handle some of the issues that were popping up at the time. I mean, that has been refined and moved forward. But it just pointed out that if you have various organizations sharing information and working together for a common goal, you can accomplish a heck of a lot more than it was mentioned before as working in separate silos. So it's a county-wide approach, and I think this is, you know, the next step in that evolution moving forward. So it's great to see it developing and moving forward. So we'll be the better for it as it does happen. So thanks so much.
Deputy Mayor Malash, go ahead.
Thank you, through you, your worship. And I too believe that mental health is something that that's an easier one that we can perhaps reach out and try and have cooperative programs to make sure that health services are more accessible in our communities. That's such a big one. And you know, with as far as housing and neighborhoods go, supports there too. I did see in the report about transportation, and that's something that we have to look at too. And it's something that the county's looked at, and it's just so costly to try and have some kind of bus system, particularly that goes even just from Windsor out into the county. It was very expensive. It was a huge increase to taxes to try and have that. But this is, again, something that's becoming more and more important. There's more grants that are being made available for affordable transportation, buses and so on. And this is something maybe that we should be looking at again, even if it's just the town of Essex that's interested in doing something. We have a line right now that goes out to Leamington and passes through Essex Center, but we have nothing in the center part of our community. And I think we'd find that there'd be a lot of use if we had something that went from Windsor through McGregor, through Harrow to Colchester and then back, just a simple route like that. And one of the reasons why I couldn't support the county transportation plan that they had originally was that didn't exist. There was a line that went out to Leamington and into Windsor, one that went out to Bell River and into Windsor, and went out to Amherstburg and into Windsor. And there was nothing in it for the central part of our town. Just touched on us, just slightly touched on us. So there's a lot of things in here that brings brought out that are definitely things that we should be looking at. And I'm looking forward to making further comments here and then looking at where we're at with it in the fall. So thank you again for coming out and sharing this with us.
Deputy Mayor, anybody else from council? If I may, I'll add to what Deputy Mayor said. Mental health is a big issue. And I've known that we've come a long ways in the last little bit through through our police themselves and through the senior level of government, promoting this. I mean, we're in a time right now, a very stressful time with this COVID, and mental health issues are way, way up. But I like the progress that I see being made through mental health. So thank you very much for coming forward. And if there's nobody else from council, I'll need a motion to accept the presentation here. Councillor Bowman, and a seconder, please. Councillor Guerin, all in favor? Thank you. And once again, thank you very much for your presentation.
Thank you, Your Worship.
So at this point here, we'll come back at 6 o'clock for a regular meeting. Need a motion to adjourn. Councillor Bjorkman and Deputy Mayor Malash. All in favor?